Okay. Hello, my beautiful people. So for the people that don't know me, my name is Kiera and I am 23 years old and I have sickle cell anemia type SS. Um, Many of you guys know I started advocating for sickle cell, when my cousin passed away at the age of 20. Sadly, she had sickle cell also and she died from a heart attack and stroke. And I'm trying my best not to cry, but this month was her birthday, and it was really hard because it's like it really came. Her death came down to medical malpractice, if we're being quite honest about it. She had been having headaches for months and months and months, and doctors kind of, well, what really happened is, when you turn 18, they change you to adult care, but this hospital, they kind of just dumped her out, and she was like in between trying to find a doctor, so she wasn't really getting pain medicine or the treatment that she needed, and sadly that ended in her death. And I wanted to talk about this a lot more because it doesn't make sense. It is 2023. There is no reason why sickle cell patients should still be dropping like flies. I'm so sorry. I forgot to even explain what sickle cell is. So for my people that don't know what sickle cell is a blood disorder that affects your red blood cells. So instead of your red blood cells being round and flexible, they are C-shaped, sickle-shaped, whatever you want to call it, and they have trouble passing through the blood vessels. And you also have to remember that your red blood cells is what carries oxygen throughout your body. So with our cells being very rigid and sticky, they get stuck and they're not able to pass through the blood vessels. So that puts you at a very high risk for having a stroke, heart attack, clots, organ damage. I already have both of my hips replaced, and that's from the sickle cell, having a recurrent crisis in the hips, and it cut off the blood flow, and I had to get both of my hips replaced. By the time I turned 18, both of them were replaced. So with that being said, I honestly, it's really just breaking my heart. I have a couple of friends that are not in a very good situation, and I really just want to speak to anybody in the medical field. Let me explain something to you. There tends to be this thing that doctors tend to think that, oh, if a sickle cell patient, if their hemoglobin is, like a 10 or so, then they can't be in a crisis, but that doesn't make any sense. And the way I explain sickle cell anemia is I explain it as two different disorders, because the doctors want to act as if your hemoglobin has to drop for you to be in a crisis, and that's just not the case, because regardless of what your hemoglobin is, your cells are still sickling, meaning that you're still having, certain organs, certain body parts not getting blood flow. So we really have to erase that, oh, your hemoglobin's fine, there's no way you're in a crisis, because that's not how that goes. So just like anemia, a bunch of people have anemia and they don't have sickle cell, right? So you have to kind of look at sickle cell like that. Just because the hemoglobin is fine does not mean they're not in a crisis. And you need to be looking at the reticulous count, the LHD. You need to do a whole CDC, I think. Oh, I'll look it up. I can't remember now. But it's just like, if a cancer patient came into the ER and they said they were in pain, they would treat the pain. They wouldn't say, oh, your hemoglobin is da-da-da, because they know that the cancer is still there. So you need to, like, doctors really need to start looking at sickle cell like that. Regardless of your hemoglobin, those sickle cells are still there. And I just want to say this. Anytime your body is having pain, that is a sign to you that something is going on. See, here's the thing. My hips decaying didn't happen overnight. It happened over years. And I always had a hemoglobin of 10, and I don't know how, but I had fetal hemoglobin up to like 16, and that's very rare. So with that being said, just because somebody's hemoglobin is okay does not mean that their body isn't causing damage. And I just want to say this, like, we were not asked to be here, and nobody wants to spend their life in and out the hospital. I'm just asking that you please treat us with respect and kindness. Treat people the way you want to be treated. Think about if you were sick or if your baby was sick, how you would want to be treated. And I hate to say it, but it does come down to racism, because, you know, sickle cell is predominantly, it predominantly affects people of color, sadly. But it's like, we have to do better. We have to do better at the treatment of sickle cell patients. And I think it's just really messed up how people act as if, you know, we're drug dealers and drug addicts or all this stuff, when usually it's really the nurses that are stealing medications. It's happened so many times. There was just a story about a lady stealing like so many doses of fentanyl from, you know, mothers that were like, you know, giving birth and stuff, and the doctors were just like, oh, y'all are dramatic. But no. And so I'm just begging you, please, please, please believe your patients when they say they're in pain. And before I end this episode, I really want to say, you have to understand that everybody handles pain differently. You know, a lot of us with sickle cell have our first crisis as a newborn. We can't communicate, we can't talk, we can't say how much pain we're in. So over time, you get used to being in pain. Just because I'm sitting right here and I'm looking okay, I'm talking, I'm communicating, I'm in a lot of pain. So please remember that. Please don't start, well, if I was in that much pain, because we're not going to play that game. Because the facts are, you're not in that much pain. You don't know how it feels like. So we're not even going to pretend. And another thing I want to say is, in children's care, they taught us distraction. So it's very odd to go into adult care and then they act as if you're not in pain because you're eating, or you're, you know, maybe FaceTiming with a friend. And it's just crazy to me. And that's how I know. It's just like, as a sickle cell patient, sometimes in the ER, it feels like you can not do anything right. Because if you scream and cry, they're going to call security on you and tell you you're being dramatic. If you try to distract yourself, they are like, oh, well, you're not in that much pain. And it's kind of like, what do you want us to do? Stop being so judgmental. Like, it's not fair. Like, so many people have died from sickle cell because of doctors not believing our pain. So, if you work in the medical field, please, please, please do your research about sickle cell. And please stop treating us like drug addicts. Like I said before, we didn't ask to be here. And we didn't ask to suffer and get treated like shit. So please be kind and treat your patients how you would want your parents or you treated or your kids treated. Please just be kind to us. We already go through a lot. Thank you, my loves.